Blisters,
Ulnar
tubercle.
side of the
Blisters,
radius.
tubercle.
Blisters.
Blisters,
Okay, so you should have, one finger on Lister's tubercle. On the radial side of Lister's tubercle is the extensor carpi radialis longus and extensor carpi radialis brevis tendons. Ask the patient to clench their fist, and the tendons will stand out on the radial side of Lister's tubercle.
She said
You
extensor.
feel those?
Extensor carpi radialis brevis and longus.
Everybody feel
We
them?
found brevis up here. Run it straight down. On the third vertical.
I thought that was extensor digitorum brevis.
I remember seeing extensor carpi radialis
Okay.
brevis. 'Cause that
Listen to this.
only went on the third.
Listen to this as I read it to you. On the ulnar side of the radial, this is tunnel, this is an old book I got this from, and evidently they've renamed the tunnels, but this was called Tunnel 3. Basically, it contains extensor pollicis longus tendon, which defines the ulnar border. So you already know that because it defines the ulnar border of the anatomical snuff box, right? Okay, so that's extensor pollicis longus, is this tendon right here. All right, this tendon comes down, and right where it passes Lister's tubercle, it takes a 45-degree turn
Thank you. Relax.
around the tubercle. So actually, it's coming down, I'm sorry, it's coming down like this. Look, it's coming down like this. And then when it passes Lister's tubercle, it takes a 45-degree angle to go to the thumb. So right where that angles is a common site of tendon rupture there, or injury. And the most common population that would have that would be your rheumatoid arthritics. So they get tendinitis there, and if it's going to rupture, it ruptures there.
Because they've got that
Okay?
turn.
It also says if your patient has had a Colles fracture and it didn't line up perfect, then it may increase the angle of that tendon turn and predispose them to tendinitis after the Colles fracture is healed. Okay. All right, we obviously, yes, we're on the dorsal surface of the wrist. All right, if you now find the radio-ulnar articulation, so the distal radio-ulnar joint, and you go just radial to the joint, the extensor digitorum EDC.
Extensor digitorum C?
Maybe I don't know. It's then and extensor.
Come in, maybe see.
Anyway, if you have them extend their fingers, you're going to feel those two tendons pass right there. You feel them? There's two tendons right there. I've got EDC and EL.
I don't know.
I don't remember. So, but I can feel both tendons pop out when I do this of my first two fingers, and I'm palpating right there. I feel the tendons right there, whatever they are. It said this is a common site for a ganglion cyst on the dorsal side of the wrist. Okay? table. And find the radio ulnar articulation again. Now, right near there, you might have to move your finger a little bit. If you ask your partner to lift their little finger towards the ceiling, the extensor digiti minimi tendon should be right around that area. You should be able to palpate it. You might have to move your finger radially or ulnarly, but you should be able to feel it. Okay, did everybody feel that? Okay. All right, we already found extensor carpi ulnaris in that groove on the ulna. Now flip your hand over on the palmar aspect, so the palmar aspect is sticking up towards the ceiling. Okay, listen carefully to this. There is, remember I told you, you can injure the ulnar nerve at your elbow, and you can injure your ulnar nerve in your hand at the tunnel of Guillain. Okay? This is where the tunnel of Guillain is. Where'd it go? There it is. Okay. It's the depression, so that's why I had you draw circles on the pisiform and the hook of hamate. The tunnel of Guillain is in between. It's the space between the pisiform and the hook of hamate. It is covered by a ligament that's called the pisohamate ligament. And the ulnar nerve runs underneath of there along with an artery. You cannot palpate the nerve in the artery, but if there's pathology, it will be very sensitive to pressure, and potentially, if you took your reflex hammer and tapped there, you would reproduce the ulnar tingling in the hand. The most common population to get problems with the ulnar nerve in the tunnel of Guillain are cyclists, from having their hands in this position all the time, and then especially if they don't wear gloves. That's one of the reasons why they should wear, if you're cycling a lot, you should wear padded gloves so you're not banging on that. Okay? So again, if somebody comes in with tingling in the ulnar distribution, so you know for sure it's ulnar nerve, the two places you should check first is at the elbow and right there. Because those are your most likely places of where the problem is. Okay? Now, the last thing that we're going to do is the carpal tunnel. So, what you need to do, you've already got a circle around the pisiform and the hook of hamate. Now you need to find the scaphoid again, and find the biggest bump on the scaphoid. Like, where is the most prominent point on the scaphoid? Because it's called the scaphoid tubercle. So as you palpate that palmar side of the scaphoid, try to find that bump and put a circle on that. And then the last, so you've got 3 circles now. The last circle, you need to palpate the trapezium. Remember, it's right underneath of the thumb on top of the scaphoid. Find the most prominent bony protuberance on that.
Stop it.
put a circle on that, and when you connect all 4 dots with lines, that's your carpal tunnel.
Seems a little too far.
Is it possible to be?
I don't know.
Turn your hand this way. Yes? Yes? Okay? So obviously, we all know the median nerve and an artery run through that. So if they are having carpal tunnel symptoms, then that would be where you would tap with your reflex hammer to see if you could get the distribution into the medial nerve. Okay? The rest of the stuff you can do on your own. We've done
I
the
only
most
saw it on
important
the
stuff.
screen. I didn't see it.
Okay? I've got to make another trip to the
Stop.
washroom, so give me
Stop.
2 to 3 minutes.